Corona, as the death rose from the virus that had no known treatment or vaccine. Countries had to shut their borders, ban travel to other countries, and began to issue orders for their citizens to stay at home, with no gatherings of more than 10 individuals. Today, in this video, I'm going to talk about this whole virus thing that created havoc worldwide. For those who don't know me, I am Kratika Mishra, and you can find content and information related to world, pageantry, fashion, food and travel on this channel. For any requests, please mention in the comment section below, or you can mail me at kratikas.vlogs@gmail.com. We do not have to panic, and we can seek medical help if required. The World Health Organization announced on March 11, 2020 that COVID-19 was a global pandemic, signaling a large outbreak of contagious disease worldwide. There were around 100 million recorded coronavirus cases in 110 countries at that time. China was the first country to have a widespread outbreak in January, followed by South Korea, Iran, and Italy, with their own outbreaks in February. Soon the virus existed in all continents and more than 177 nations, and as of writing, the United States had become the highest number of reported cases and unfortunately the largest number of deaths. Globally, over 430 million enterprises are at risk of disruption, with about half of those in the wholesale and retail trades. Much focus in the press has been on the impact in Europe and North America, but the effect on developing countries is even more critical. An example of the latter is the Bangladeshi ready-made garment sector, a global industry that depends on a supply of raw material from a few countries and produces those garments for retail stores throughout the North America and Europe. But in January 2020, raw material from China was delayed by the shutdown in China, creating delays and work stoppages in Bangladesh. By the time Bangladeshi factories had the material to make garments, in March retailers in Europe and North America began to. Clearly, COVID-19 has had enormous disruption on work and workers, most critically for those who have lost their employment. But even for those continuing to work, there have been disruptions in where people work, with whom they work, with what they do, and how much they earn. And as of this writing, it is also a time of great uncertainty as countries are slowly trying to ease restrictions to allow people to go back to work in a new normal without the ability to predict if they can prevent further infectious spikes. The anxieties about not knowing what is coming, when will it end, or what work will entail led us to develop this set of essays about future research on COVID-19 and its impact on workers and work. Severe acute respiratory syndrome coronavirus 2, which causes coronavirus disease, was first identified in December 2019 in Wuhan City, China, and later spread to many provinces in China. As of May 8, 2020, the World Health Organization had documented 375,909 positive cases worldwide, and the death toll contributed to COVID-19 has reached around 25 million worldwide. So far, more than 212 countries and territories have confirmed cases of SARS-CoV-2 infection. On January 30th, 2020, the WHO declared COVID-19 as public health emergency of international concern. The first SARS-CoV-2 positive case in India was reported in the state of Kerala on January 30, 2020. Subsequently, the number of cases drastically rose. According to the press release by the Indian Council of Medical Research on May 8, 2020, a total of 14,37,788 suspected samples had been sent to National Institute of Virology, NIV, Pune, and the related testing laboratory. Among them, 56,342 cases tested positive for SARS-CoV-2. A statewide distribution of positive cases until May 8, 2020, and the cases have been depicted on the Indian map. Nearly 1,97,192 Indians have recently been repatriated from affected regions, and more than 1,30,000 13,300 passengers have been screened for SARS-CoV-2 at Indian airports, with 111 positive cases observed among foreign nationals. As of May 8, 2020, Maharashtra, Delhi and Gujarat states were reported to be the hotspots for COVID-19, with 17,974 in total confirmed cases respectively. To date, 16,540 patients have recovered and 1,86,000 As WHO and partners work together on various responses, tracking the pandemic, advising on critical interventions, distributing medical supplies to those in need, they are racing to develop and deploy safe and effective vaccines. There are currently more than 50 COVID-19 vaccine candidates in trials. WHO is working in collaboration with scientists, business, and global health organizations through the ACT Accelerator to speed up the pandemic response. When a safe and effective vaccine is found, COVAX, led by WHO, GAVI, and CEPI, will facilitate the equitable access and distribution of these vaccines to protect people in all countries. People most at risk will be prioritized. While we work towards rolling out a safe and effective vaccine fairly, we must continue the essential public health actions to suppress transmission and reduce mortality. Covaxin TM, India's ingenious COVID-19 vaccine by Bharat Biotech, is developed in collaboration with Indian Council of Medical Research, ICMR, and National Institute of Virology, NIV. Stay tuned and stay safe for more informative content. Do hit like, subscribe button along with the bell icon to get notified about the next video. Bye people and take care.